Hi there. Welcome once again to the program Your Doctor in COVID. I'm Dr. Mahendra Carpen. I'm the head of medical services and cardiology at the Georgetown Public Hospital Corporation. We continue to have our discussions around the COVID-19 pandemic. And as usual, before we start this discussion, I want to demonstrate to you the proper way of wearing your mask. One should always take the mask by the straps and put it over the face to cover both the nose and the mouth. And that is the correct way to wear the mask. It is not correct to wear it over just the mouth to expose the nose. It is not correct to wear it under the chin. So I will take it off for the remainder of our discussion so that we can have a more productive conversation. I'm putting no one else at risk because no one is close to me, and I myself am not being put at risk by anyone. So we continue answering questions. We continue, looking at concerns from viewers and listeners just like yourself. And remember, if you have any questions or comments, please feel free to send a WhatsApp message to 620-6275, or you may send an email to docandcovid@gmail.com. Before we look at the particular question that was posed, I would like to update you on what's happening in the country. We're now in the second week of January 2021, and so far we have recorded 6,574 cases. That's 6,574 cases. We now have 169 deaths and 6,036 recovered cases. In terms of percentages, that's what we need to look at. We have a case fatality rate of about 2.5%. That is being maintained since late last year to present time. The case fatality rate is essentially the percentage of patients who would have died versus the overall number of persons who are infected. And the recovery rate, if you look at the numbers that we have, over 6,000 persons recovering, that represents a recovery rate of over 92%, which is quite in keeping to the standards for the rest of the world. If we look at our active cases, this is where one can see that we had our peak again recognized in September, October, with a steady decline. But if you look at what's happening in early 2021, there is a signal in this graph that shows that we're having a little bit of an upturn, and perhaps that is a signal that we are going to have a lot more cases testing positive in the future. That is not surprising, especially we are coming out of the Christmas holidays where people would have had a lot of interactions with each other, and that would have been putting themselves and those around them at risk. You never know who is infected, and if you do not take the right precautions like wearing your mask, sanitizing your hands, and maintaining social distancing, that is the highest risk that you can put yourself and others around you at. So we continue to look at questions and scenarios posed by our fellow Guyanese. And here is one that is actually quite common. And we have a lot of mosquitoes in Guyana. We've always had mosquitoes. And so the question that was posed, can COVID be transmitted by mosquito bites? So I don't know about you guys, but I grew up in the countryside. And we had 2 seasons. In Canada and America, you have 4 seasons with winter, spring, summer, and fall. In the countryside, we got 2 seasons, mosquito season and sandfly season. And so it's very easy for us to relate to this kind of question. Can COVID be transmitted by mosquito bites? Well, in order to understand this, let us look specifically at how the established transmission has been described. Transmission of COVID-19 starts with an infected individual. That individual can cough, sneeze, or simply breathe, and that can release droplets. These droplets are in the air, on surfaces, and can then put another individual at risk through breathing the airborne particles or coming in direct contact with a surface that these infected particles are resting on. That is the standard established way of transmission. So summarize this, there are three well-recognized ways of transmissions. One is through respiratory droplets. The second is through contaminated surfaces. And the third is by direct contact with an infected person. Those are the three main ways, or the three recognized ways of transmission. It's important to note that there's a difference between droplet and airborne transmission. Droplet transmission occurs through coughing and sneezing, and this actually spreads droplets of saliva and mucus, which can be from direct person to person or person to surface. An airborne transmission is made up of tiny particles, possibly produced by talking. They are suspended in the air for longer and can travel further. So it's mainly the size. And these are less than 5 microns. That's very, very small. And just for reference, a human hair is about 60 to 120 microns wide. So these airborne transmissions are these particles are much, much smaller than the human hair. The next not so common way of transmission is through contaminated water. And so you could drink contaminated water. We have known for some time that the viral particle can be found in human feces. Unfortunately, in unsanitary condition, when that comes in contact with water that is then consumed by humans either to clean surfaces or for human consumption, then that can now be another method in which persons are infected. And we call that the fecal-oral route. The water becomes contaminated and persons can drink it, or the water is used to clean surfaces and you can touch those surfaces and then touch your nose, your mouth, your eyes, and these can all lead to further infection of an otherwise healthy, normal human being. That can occur directly through the gastrointestinal tract, and then it can also occur in the respiratory tract, which is not surprising that a lot of persons with COVID have gastrointestinal symptoms like abdominal pains and diarrhea, nausea, and vomiting. Those are all common ways that gastrointestinal illnesses can present themselves. So, to be very clear, the fact as proposed and supported by the World Health Organization is that the new coronavirus cannot be transmitted through mosquito bites. To date, there has been no information nor evidence to suggest that the new coronavirus, COVID-19, could be transmitted by mosquitoes. COVID-19 is a respiratory virus, and this spreads primarily through droplets generated when an infected person coughs or sneezes, or through droplets of saliva or discharge from the nose. To protect yourself, you should clean your hands frequently with an alcohol-based hand rub or wash, or then wash them with soap and water. Also, avoid close contact with anyone who is coughing or sneezing. That is very important to note. So the fact is that COVID-19 is not transmitted through mosquitoes or mosquito bites. This was actually examined in a large series in the US, and 3 of the more common types of mosquitoes that are found were actually examined: the Aedes aegypti, the Alboptis, and the Culex mosquitoes. These are 2 of the most significant arbovirus vectors that infect people, and these were tested. This is the conclusion. It was demonstrated that even under extreme conditions, COVID-19 virus is unable to replicate in these mosquitoes and therefore cannot be transmitted to people, even in the unlikely event that a mosquito fed upon a viremic host. A viremic host is someone who is infected and has a certain level of viruses circulating in their blood. That's someone we would describe as viremic, meaning that the virus is active in their body. So even if the mosquito bites such a person and then flies a couple meters and bites someone else, there is no evidence to suggest that the mosquito can transmit this virus from the viremic or infected host to the other person who is a bystander. Mosquitoes are known to spread many diseases, and we ask ourselves, what are some of these things or diseases that mosquito can spread? Very commonly in Guyana, especially in the interior, we know that mosquitoes can spread malaria, and a lot of our public health effort are directed towards control of mosquito. One group of mosquitoes called Culex can spread the West Nile virus, and this is present in some major US cities like Los Angeles. Another group called the Aedes mosquito have the potential to spread Zika, dengue, yellow fever, and chikungunya. And we remember a couple years ago there was a massive outbreak of Zika and chikungunya that affected Guyana, Brazil, and a lot of tropical countries. So these are specific conditions that can be transmitted by mosquitoes. But fortunately, especially fortunately for countries like ours that are, have a lot of mosquitoes, we do not have any evidence to suggest that mosquitoes can transmit this virus from person to person. There are several other ways in which the virus can spread from person to person, and some of the other ways, apart from the coughing and sneezing and the respiratory way, human contact, such as kissing, can cause the spread of the virus. And that is so because it is present in saliva. Another question that we have had to answer before on this program is the safety of breastfeeding. And again, I want to clarify and reaffirm that there is no evidence whatsoever that the virus is transmitted from mother to child through breast milk. So it is still a top priority and recommendation that a mother should continue to breastfeed their newborn child. If the mother is positive, then she should take all precautions by wearing a mask and sanitizing, etc. But there is no evidence of direct breast milk to infant transmission. Sexual activity has not been shown as a method of transmission, although the virus has been found in human semen. So I hope this clarifies significantly modes of spread, and particularly the question about the possible spread through mosquito bites. So thank you once again for joining me today. Remember, if you have any questions or comments, feel free to send a WhatsApp message to 620-6275, or you may send an email to docandcovid@gmail.com. Thank you very much.